Smoking is one of the leading causes of preventable deaths worldwide. Each year, millions of people die from diseases directly caused by smoking. From the first puff, tobacco smoke starts a cascade of health effects that accumulate over time, damaging almost every organ in the body. We'll delve into the many ways in which smoking kills, highlighting its impact on the heart, lungs, immune system, and even mental health.
Tobacco comes from the leaves of the Nicotiana plant, mainly Nicotiana tabacum and Nicotiana rustica, native to the Americas. It thrives in warm, well-drained soil, with major producers including the United States, Brazil, and China. After harvesting, the leaves are cured through various methods to enhance flavor and reduce harshness. They are then sorted, aged, and processed into forms like cigarettes, cigars, and chewing tobacco, often blended with flavorings before being packaged for sale. This process reflects the agricultural, cultural, and industrial aspects of tobacco production. Today, we will be discussing smoking, an important topic that affects millions worldwide. We'll explore its origins, the health risks associated with tobacco use, and the reasons why many people struggle to quit. Welcome back to our channel. The harmful substances in cigarettes. Cigarette smoke contains over 7,000 chemicals, many of which are toxic. Among the most dangerous are nicotine, the addictive substance that makes smoking hard to quit. It increases blood pressure and heart rate, contributing to heart disease. Carbon monoxide, a toxic gas that replaces oxygen in the blood, making it harder for the body to receive the oxygen it needs. Tar is a sticky, black substance made up of multiple chemicals that coats the lungs when smoke is inhaled. Carcinogens, chemicals like benzene, formaldehyde, and arsenic that directly cause cancer. How smoking damages the lungs. The lungs are the first organs affected by smoking. Inhaled cigarette smoke irritates and inflames the airways, causing chronic coughing, wheezing, and shortness of breath. Over time, this irritation leads to permanent damage and diseases such as chronic obstructive pulmonary disease, COPD. COPD is a group of lung diseases that block airflow, making it difficult to breathe. Smoking is the leading cause of COPD, which includes emphysema and chronic bronchitis, lung cancer. Smoking is responsible for about 85% of all lung cancer cases. The carcinogens in cigarette smoke mutate the DNA in lung cells, causing them to grow uncontrollably. Asthma. Smoking can exacerbate asthma symptoms, leading to more frequent and severe attacks. Cardiovascular impact. Smoking and the heart. Smoking damages the cardiovascular system, significantly increasing the risk of heart disease and stroke. Here's how. Narrowing of blood vessels. Smoking causes blood vessels to narrow and harden, a condition called atherosclerosis. This restricts blood flow and increases blood pressure. Heart attacks. Smokers are 2 to 4 times more likely to have heart attacks than non-smokers. The combination of increased heart rate, higher blood pressure, and reduced oxygen supply puts enormous strain on the heart. Strokes. Smoking damages the blood vessels in the brain, leading to an increased risk of stroke. Smokers are 50% more likely to suffer a stroke than non-smokers. The immune system, weakening the body's defenses. Smoking impairs the immune system, making it harder for the body to fight off infections and diseases. Smokers are more susceptible to infections like pneumonia, the flu, and tuberculosis. Here's how smoking weakens the immune system. Cancers caused by smoking. Smoking is a leading cause of many types of cancer. Besides lung cancer, it is also responsible for cancers of the mouth, throat, and esophagus. Smoking causes persistent irritation and damage to the lining of these organs, leading to cancer. Bladder. The carcinogens in cigarette smoke are absorbed into the bloodstream and filtered out by the kidneys, where they damage bladder cells. Pancreas, stomach, and kidneys. Smoking increases the risk of cancer in these organs due to the harmful chemicals that travel through the bloodstream and affect various tissues. Reproductive and developmental issues. Smoking has a significant impact on reproductive health for both men and women. In men, smoking reduces sperm count and can lead to erectile dysfunction due to restricted blood flow. In women, smoking can cause reduced fertility. Smoking damages the reproductive organs and can lead to difficulties in conceiving. Pregnancy complications. Smoking during pregnancy increases the risk of miscarriage, premature birth, low birth weight, and sudden infant death syndrome, SIDS. The harmful chemicals in cigarette smoke restrict oxygen flow to the baby, leading to developmental problems. The brain and mental health. Nicotine is highly addictive, and smoking has profound effects on the brain. Over time, smoking alters the brain's chemistry, making it harder to quit. Here's how smoking affects mental health. Addiction. Nicotine activates the brain's reward system, releasing dopamine, a chemical associated with pleasure. Over time, the brain becomes dependent on nicotine to release dopamine, leading to addiction. Anxiety and depression. While smoking may temporarily reduce stress, it actually increases the risk of anxiety and depression in the long term. The brain's dependence on nicotine for mood regulation makes it harder for smokers to feel good without smoking. Cognitive decline. Smoking accelerates cognitive decline and increases the risk of Alzheimer's disease and dementia. The reduced oxygen supply to the brain, combined with the toxic effects of smoking, leads to faster brain aging. The social and economic costs of smoking. In addition to the direct health effects, smoking imposes significant social and economic burdens. Smokers often face higher medical expenses due to the many diseases caused by smoking. The cost of cigarettes themselves is also considerable over a lifetime. Furthermore, secondhand smoke. Non-smokers exposed to secondhand smoke are also at risk of many of the same health problems, including lung cancer, heart disease, and respiratory infections. Lost productivity. Smoking-related illnesses often lead to missed work days, reduced productivity, and early death, affecting not only the smoker but also their families and society at large. Quitting smoking. The road to recovery. The good news is that quitting smoking can significantly improve health, no matter how long someone has smoked. Within hours of quitting, the body starts to heal. Within 12 hours, carbon monoxide levels in the blood drop to normal and oxygen levels increase. Within a few weeks, lung function improves and coughing and shortness of breath decrease. Within a year, the risk of heart disease is cut in half. Within 10 years, the risk of lung cancer drops to about half that of a smoker, and the risk of other cancers decreases. Quitting smoking can be challenging, but with the right support, it is possible. Counseling, nicotine replacement therapy, and medications can all help in the process.
ये वीडियो आपको अच्छा लगा तो लाइक और सब्सक्राइब करना ना भूलें। मिलते हैं अगले वीडियो में। नमस्कार।